Many rural hospitals have been challenged with maintaining obstetric services, but are now partnering with others to improve birth outcomes for mothers and babies. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hitterly, Senior Writer with AHA. In this podcast, highlighting successful maternal and child health efforts, we're speaking with care team members from Kearney County Hospital in Lakin, Kansas, as they discuss the importance of a growing OB unit and share the impact of Kearney County's Pioneer Baby program. Joining me to talk about this program are Dr. Arlo Reamer, Chief Medical Officer, Lacey Millell, Clinic Operations Manager at the Family Health Center Clinic, Becky Chappell, Perinatal Unit Supervisor, and Lilia Rainey, Maternal Child Health Nurse. Thank you all for joining us today. Why don't we start with a little background about Kearney County Hospital? You were faced with a difficult decision that so many rural hospitals face, namely how to financially support and safely maintain an obstetrics unit. Please tell us a little bit more about your hospital, the community you serve, and how the decision was made to keep the OB unit.
Sure. Well, I'm going to let Dr. Reimer take that because he's been here for a long time and through all of those decisions.
So yes, I have been practicing here for about 20 years, later on this year anyway. Lakin is a town of about 2,400 people. The Family Health Center's primary care footprint has expanded from roughly 2,000 patients when I first came here in the year 2000 to approximately 22,000 patients. So that expansion has come with additional providers that's helped our growth. As we look at our OB program, we never really considered closing it. We view delivering babies as a critical component to the care that we provide here in Lakin. We have always strove to provide well with high quality, meeting national standards.
Our primary care footprint expands to about 12 counties in southwest Kansas. Our OB practice specifically, we have OBs that come from counties in eastern Colorado and even a few a little bit more north central Kansas as well.
They travel up to 2 hours in order to come and see us here in Lakin.
So we've gone from, in 2014, I believe we had about 9,000 total visits in a year, and then 32,000 visits this last year. We're certainly have gotten a lot busier over time. And from a birth standpoint, in 2014, we had 187 births, and now we're averaging 20 to 25 births per month.
Kearney implemented a number of creative tactics and initiatives. Let's talk about Pioneer Baby. What is it, and when and how did it start?
Pioneer Baby is a program that we started in 2015. It included some funding for a transport isolate, funding for high-risk specialist, Dr. Wolf, who's a perinatologist coming from Wichita, so it paid for his flights to Lakin. And then it also paid for computer software for our OB unit.
And that was funded through the Children's Miracle Network.
So the other parts of what we thought about, what was necessary to grow the OB practice was recruiting high-quality, full-spectrum family physicians. We went from 2 providers, delivering providers in 2010. At 2015, at the beginning of the Pioneer Baby program, we had 4 delivering providers, and now we have 8. The other part that we ramped up and supported was just our nursing staff training, making sure that we were still able to meet quality standards and having staff that were comfortable in the OB unit with laboring moms.
And I would say that our philosophy that we have to take care of the moms and the whole family, the rest of the family will follow. But with that, we accept patients. It doesn't matter their payer source.
Mm-hmm.
So the increase in births help the nursing staff to maintain their skills.
We also have 2 full-time dedicated CRNAs, which is super helpful, which is a critical need for a lot of rural hospitals that are deciding whether or not to continue with OB services. Usually anesthesia is a big component of the decision. We went from having 1 to 2, and having them available certainly does allow for us to offer more full-spectrum family medicine services like screening, endoscopy, and all of that as well. Certainly in terms of sustainability, having them available for OB also allows us to utilize them in other areas as well.
So what impact has Pioneer Baby had so far?
When we started with Pioneer Baby, we were skimming back through emails and found them starting in 2014. Doctor, specifically, like the idea, the name Pioneer Baby came with the initial funding request from Children's Miracle Network and bringing out Dr. Wolf. And then, like we said, the software for OB, and then with the transport isolate. So Dr. Wolf's been coming out who's a maternal fetal medicine specialist out of Via Christi, Wichita. And he's been coming out here since August of 2015. And we kind of looked back and saw he's seen at least 460 visits. He comes out monthly and has really been a key partner for our medical staff over the last 5 years. Our numbers since then have gone from, we said 187 in 2014 to 289 deliveries in 2019 calendar year. And a big part of that has to do with the partnership with Dr. Wolf and our ability to help manage our high-risk OBs closer to home for as long as possible. It's been a great partnership in terms of having somebody to call that'll take your phone call, that will answer. I think over the last 5 years, each of our delivering providers have become more comfortable with managing their high-risk deliveries just because Dr. Wolf has been a phone call away to consult with and to help make decisions.
So what's in the future for Pioneer Baby? How do you see it growing or changing or evolving?
So certainly we have been able to maintain quite a few of our quality measures and actually add other ones on, maintaining the no elective inductions before 39 weeks. We've worked on quantitative blood loss initiatives, the OB, hemorrhage risk assessment, timely treatment for hypertension and preeclampsia, and also begun participating in the neonatal abstinence. Certainly our demographics have been changing over the course of the last 5 years as well in that regard. It has shifted our perspective, I think, on how we handle prenatal care and postnatal care, in that we're trying to grow and achieve and maintain quality standards. And I think that we push ourselves a little bit harder, asking what can we do a little bit better based off of the information that we're learning all the time.
One area of focus for Pioneer Baby was looking at gestational diabetes. When we looked at the statistics, the facts were that there were about 11% of our moms that delivered here had gestational diabetes in 2014. Looking at how do we care for them, how can we impact perhaps not the rate, but how can we impact to make babies healthier and moms healthier during pregnancy. That was certainly part of the reason that Dr. Wolf came out, to see that segment, but just to provide better care. Our current rate of gestational diabetes has dropped from 11% to 4%.
So it's certainly changed how we deliver care. I think that we've always felt like we delivered care really well. We've partnered with different groups, including KU School of Medicine. We've participated in several research grants with Seth Jacobson, who's a researcher at KU School of Medicine in Wichita. It has allowed us to change some of the ways that we provide care. So in terms of thinking about one-on-one education with our moms, which we started with an MCH nurse back in January, so it's been a year now. about 1 year. So having all of our initial OB appointments be one-on-one with a nurse educator, having appointments with her throughout each trimester and then postpartum in terms of checking in, delivering all the pertinent education and making sure that moms are feeling comfortable. It changed how we've done our prepared childbirth education classes over a period of time and really developed a model that we feel like is effective and helpful for our families, because rural OB patients have very different needs and concerns than urban moms do in terms of access and travel and time and all of those things. So needing to make sure that the information we deliver is high impact at times when it's accessible to them in an effort to make sure that we're taking really good care of our moms.
What have been some of the lessons learned since starting this initiative? What surprised you the most?
I think the biggest lesson we've learned, we were talking about this before our phone call, and we talk about it frequently because we have our MCH team that meets together a couple times a month to kind of talk through the initiatives that we're going on. But what surprised us the most over the course of time and our partnerships with varying providers, be it Dr. Wolf or with the KU School of Medicine or different ones, is just how different the needs are between urban and rural OB patients. The challenges that they face are very different, and not always an app-based solution is what works best for a rural mom. They really value their connection and conversation, and they want, it seems, a really intimate interaction, either with their provider, if it's their OB nurse that's helping them with delivery on the floor, or the CLC nurse who is helping them with breastfeeding, or the MCH nurse. The connection is just really important, and we've tried to automate that over the course of time in different ways, but we have been surprised that that is not what our rural moms want. They really want intimate conversation around their needs. So that has guided a lot of the decisions that we've made in terms of developing our MCH program, having the one-on-one education, and gone through the CDC's Empower training for breastfeeding and built-in continuous education for our OB nurses, and invested in CLC training for staff to be on around the clock if possible, which are all strategic moves from an administrative standpoint too, to be willing to invest the limited resources that we have in a critical access hospital into really making sure that our moms and babies have the best outcome possible. So I think that hits the nail on the head in terms of what we strive to provide for our OB patients and for all of our patients, regardless. It's just our mission is to provide quality, compassionate care, but the compassion component is what our patients seem to care the most about, and we strive to take the time at the bedside with the one-on-one OB nurse and take the time throughout pregnancy to sit and visit and have hour-long conversations with moms throughout their pregnancy, answering their questions, taking the time as a physician or a provider to see them throughout their entire pregnancy, and then take care of their babies once they deliver. Like it's the same experience throughout. So it's really an intimate connection and a really personal connection between rural patients and their healthcare providers. It's just very different than in an urban setting.
And we do take a lot of pride in the education for all of our staff and maintaining quality standard care and developing that trust with our patients.
We've definitely learned along the way, which has been nice to have long-standing partnerships with people like Dr. Wolf and like Lizette Jacobson, the researcher. We know each other all very well at this point and have learned to trust each other whenever one of us pushes back on the other with a different suggestion or a different idea, different approach. The Pioneer Baby program from inception to present has allowed for that long-standing relationship with them. So, go ahead, Becky. Sorry.
I think just continuing more with a quality measure. Right now we're working on improving our care that we would provide for neonatal that may be having withdrawal symptoms. All of our providers are working with KPQC initiatives. So that's
where we're headed, certainly. So as we've changed our approach over the last, several years, and very specifically in the last 12 or 18 months, we are getting to know our moms in a more personal level. We're finding things out about the community that we're serving that maybe we didn't necessarily know before, with those just standard prenatal visits and then into the delivery room. And as we're starting to see the various social determinants of health and the struggles that people are going throughout their pregnancy, not all, but some, we're trying to address those gaps in care, gaps in services for more of our high risk that aren't necessarily high risk medically, but high risk in terms of social determinants. That's kind of what we're looking at focusing on.
So, yeah, I agree. The focus on the NAS, focusing more on preeclampsia and the rapid identification of when that occurs, and then addressing it appropriately, whether that means transferring the patient to a higher level of care, for instance, to Dr. Wolf in Wichita, or to safely deliver the patient here.
It's very inspiring how Kearney County Hospital has not only maintained but grown your OB program. Pioneer Baby is a partnership that is improving the health of not just mothers and babies, but strengthening your community. Thank you, Dr. Reamer, Lacey, Becky, and Lilia, for joining us today and sharing more information about Kearney County Hospital and Pioneer Baby. This has been an excellent example of how partnering with other health systems and community resources improves outcomes for mothers and babies. For more podcasts and additional tools, resources, and education for improving outcomes for mothers and babies, please visit the Maternal and Child Health website at www.aha.org/advocacy/maternal and child health. Thanks for listening.